Hi, I'm Dr. Jamie Swale, and we're going to talk today about low back pain during pregnancy. So there's three main factors that kind of explain why people tend to get more pain during pregnancy, especially in their lower back. One, you're obviously putting on a lot more weight, so that increases the stress to your spine. All of that weight is forward in your stomach, so you get an extra lordosis or that curvature in your lower back. Weight's pulling forward, so there's more stress on the muscles and the ligaments in the back of your body. And also, especially towards the end of pregnancy, you get that relaxin that releases, so your ligaments are becoming more stretched, your body's more flexible, it's less stable, and your pelvis is starting to shift positions. So we're going to demonstrate a few exercises that are good for your core stability and should help with low back pain. All right, the first exercise we're going to show you is a plank. So ideally you get on your elbows and your toes, and you have this nice straight line from your shoulders down to your ankles. And you can see how Audrey's back is nice and flat. She's not letting it sag down. And that's going to have you feel nice and tight in all of your abdominal muscles there. If this is too challenging, you can start from your knees and it takes a little less stress off. Same idea, nice straight line from your knees to your shoulder. Don't let your back sag, so you're kind of pulling that stomach in a little bit. And you can hold for 10-20 seconds. As you get stronger, just work that duration up towards even 1 minute or so at a time. All right, come up to your hands and knees, and we're just going to do a cat exercise. So you want to start in that neutral spine position. Don't let the belly weight kind of pull you down and arch your back. And then you're going to press your back up towards the ceiling as far as you can. And come back down just to neutral. Good. And up. So again, you're tightening the muscles that are going across the stomach and not getting yourself into any overstretched, extended position, adding more stress to those abdominals. Okay? So from here, you're in a little bit supported position so the abdominals aren't overstretched, and you can keep your legs together and just do a small knee lift and lower down nice and controlled. You don't want to let those feet plop down or land really hard, but it's going to work those lower abs. You have to keep everything braced nice and tight before you lift, or it will put extra stress on those vertical abdominal muscles there. Okay. We call this in the clinic a bird dog. So keep everything nice and tight. You want to try to avoid letting your trunk or torso move during this exercise. And you're going to lift out the opposite arm and leg, trying to keep that neutral spine position. Slowly lower it back in and alternate. If this is too challenging or you feel really wobbly or can't hold still, you can start with just an arm lift first. And same thing, alternate. Or in the opposite, just a leg extension. Good. And she's really strong, doing great. So if you do one where your back kind of sags a little bit, where you lift out, yep, that's what you want to avoid with these planks and lifts, is letting that spine shift into a poor posture. So if any of these exercises feel like they increase your pain, are too challenging, or maybe your situation is more complicated because you've had back pain or issues even before you became pregnant, then you may need a more individualized program. You can speak with your doctor to make sure it's okay for you to do certain exercises, or get a physical therapy appointment to be more thoroughly evaluated.